Good morning the audience. My name is
Jakkrapong Keawboonruang.
I would like to present the research, Optimal Pelvic Reduction Clamp Placement Areas for Transverse Acetabular Fractures, a study of 20 patients' CT data from Bangkok Hospital. For this research, I was supported by Dr.
Vajara Phiphobmongkol
from Bangkok Hospital. For the background of this researcher, we have an idea about in treatment of transverse acetabulum by posterior approach to reduction and fixation. Usually, for this fracture for the posterior approach, we need to reduce the fracture by using a Schann's pin, bone hook, or any instruments. And after that, we need to temporary fixation to maintain reduction before we fixation with pelvic reduction clamp. We found that we can use a pelvic reduction clamp by only one to maintain the bone fracture, by a clamp at a suitable position. Only one pelvic reduction clamp made it easy to next step fixation because made you not interfere to fixation in the limit area. But this process needs high experience. You may need too much time to find a suitable position to place the clamp to make bone good contact together. This is the real case that came with the diagnosis that transverse with posterior wall acetabulum fracture. This case needs to operate by posterior approach to reduction and fixation for the posterior wall of the acetabulum. When looking in CT, this is the 3D CT of this patient. You can see the pelvis and acetabulum separated into many big pieces. And the head of the femur had posterior dislocation too. But after reduction, you can see that we can use only one pelvic reduction clamp to maintain the reduction of the fracture. So, for this research, we have the purpose to find the optimal position to place the bone clamp by using only one in a posterior acetabular fracture that needs the posterior approach. And other purposes can reference these points to others doctors, teams, or nurses. For material and method, we collect CT data of 20 patients that have been diagnosed with a transverse acetabular fracture in Bangkok Hospital between 1 January 2009 to 31 May 2020. And define the name of the area on the pelvis bone. We define a method to find the optimal point on the pelvis bone to place the pelvis reduction clamp. Collect data. Analyzed it to present a descriptive study to show the most frequency points. We have named the area on the pelvis bone by using a line pass from the dominant structure to divide the area into both sides of the pelvis. Define a method to find the optimal points. The 2 points perpendicular to the fracture plane will make the fracture most stable. So, we use data from CT to find 2 points by using this principle. We used the application, Strativen Checkpoint, to find the 2 points. This application will import data of 3D CT and render images of pelvis bone and fracture site. For the method to find the 2 points, we start from the inner side by adjusting the image to show to fracture site. After that, create 3 points on fracture line for created a fracture plane. And then, we created fracture plane. After that, create 3 points on the fracture line for created a fracture plane. And now, we can make a perpendicular axis from the fracture plane. The perpendicular axis will be throughout the cortex. So, we mark this point position that is the optimal point for fixation. For the outer side, do the same method. And mark a point that perpendicular axis throughout like the inner side. After that, we compare the analytic point that we get with the defined area on the pelvis bone. For this example, the inner side, the point is in area name, 2. And the outer side, the point is in area name, SL. So, for this case, the pair of position names is 2SL. Now we get the result from 20 patients. This table shows the area for optimal bone clamp fixation for each patient. And we conclude that 3 pairs of positions are 2LS, 1SL, and 2SL. What does it mean for these pairs of positions? For 2LS, it means that the inner side of the pelvis has optimal point at a mid-area of quadrilateral and just below the pelvis rim. And the outer side is on the posterior wall of the acetabulum on the upper part. You can see this type has 15 patients or 75% of all patients. For 1SL, it means that the inner side of the pelvis has optimal point at an anterior area of quadrilateral and just below the pelvis rim. And the outer side is on the superior wall of the acetabulum. You can see this type has 3 patients or 15% of all patients. And the last one is 2SL, which means that the inner side of the pelvis has optimal point at a mid-area of the quadrilateral and just below the pelvis rim. And the outer side is on the superior wall of the acetabulum. You can see this type has 2 patients or 10% of all patients. for discussion in this research. You can see that the result in this paper show position 1, and 2 for inner side, LS, and SL for outer side. Because fracture line in transverse fracture of acetabulum will throughout to the weakest point. So, the anterior fracture position is about mid or anterior to the quadrilateral wall of the acetabulum. For inner clamp position, just anterior to fracture is suitable for the place the clamp, that means the area name, 1, or 2. And for outer clamp position, should be the opposition at area 1, and 2, so, LS, or SL, is the position that's suitable for place bone clamp. The research shows that pair of position, 2LS, is the most frequent position for place bone clamp. That means if you use these positions, it will have a high success rate for temporary fixation for acetabulum fracture, and make sure that the fracture does not move while you do the operation. We call these pair of points,
Vajara
points, for communication for doctors, nurses, and teams. Thank you for attending my presentation.